The field picked you. Okay, good. All right. So we're going to do another demonstration for the cranium. Again, the first thing that I do is I calibrate. So show me yes, show me no. I calibrate with every patient. And I always ask permission to learn, yes, okay? And permission to do work on the cranium. We're going to do realignment with a recoil. I have permission, good. So even though this may not be her priority, there's something there that we can work with. So to navigate, I can say, is the face the priority? No. Is the base the priority? No. Is it the vault? Yes. So she's the vault. So the vault is, we could say, is it the frontal bone that's the priority? No. Is it the parietals that are the priority? No. Is it the occiput that's the priority? It's a maybe. Temporal bones, yes. So temporal bones coming up again. So is it the left one? No. It's the right one? Yes. It's interesting when I look at her face, it's much more rounded on this side than this side. I just caught that. And again, as I look, as I feel her temporal bone, I feel that same pattern. The right side is more anterior. I'm going to evaluate. Both sides are just locked here. And I'm going to look at the occiput at the same time, just because the occiput was coming up. I mean, it's funny that when you do this, I would pull all three of them out, but because this is level 1, I'm just going to work on one at a time. So there's an asymmetry there. Feel the occiput, feel the temporal bones, you'll feel the asymmetries. There's something going on there in the back of her head.
Yeah, there's something going on in the back.
There's something.
Many things.
Many things.
Yeah.
All right. I actually want to do a few other things, but we'll take it one at a time here. Okay. Tomorrow, yeah.
We have tomorrow.
Exactly. So what I'm going to do is I'm going to have you touch her temporal bone, and I'm going to do the work, and you can do the feeling. So what I'm going to do, first of all, is step number 3 a priority? No, we're okay. So I'm going to take that hologram out. And I'm going to be here, and I'm just going to observe it. It's kind of like in a hold space. Now it's starting to move. It's kind of going into an internal rotation. The mastoid's flaring out. It's going in. It's dipping down. I think that's where it wants to be. Breathe in and out. Tap over the... Good. And I'm just going to hold it there. There it goes. Okay. And then breathe in. And out. And breathe in. And out. I'm going to tap over the temporal bone. Good. And breathe in. And out. Good. And breathe in. And out. Good. So, temporal bones are even. Actually, the right one is moving. Left one is stuck. Occiput is better. Feel that. So it's interesting. The left one is actually still stuck. That's what I mean. Yeah. Yeah. I would do this clinically a little bit differently, but I just want to show you one at a time.
Yeah, the occipital base has changed.
Yeah, that's changed. The occiput changed, and the right temporal bone changed, but the left one, even though that wasn't a primary, it's still stuck there. So is the right temporal bone still a priority? No. Where was I? The vault. Is the vault still a priority? Yes. Okay. So is it the frontal that's the priority? Priority? Is it the parietals? No. Is it the left temporal? Yes. The left temporal wants a little bit of work there. All right. Is positioning a priority? No. So I'll switch places with you if you want to feel that. And I'm just having him do it because he's a cranial instructor. I want him to, he's your feedback. So I'm going to take this temporal bone out. Actually, it doesn't want me to go much further than this. And I'm going to feel it. It actually wants to come in again. Both of them want to go into internal rotation. So it's coming in like that. Quite a bit. More than the other side. So that's quite a bit. Wow. Still going.
Lots of heat coming out.
Lots of heat coming out. Still going. There it goes. Breathe in and out. Tap over your heart.
Significance detector.
This one's really, I can really feel the thickness in my hand.
There's still a significance detector.
There it goes. Breathe in. And out. Good.
Rhythm's kind of
Breathe in.
Herbert, what were you feeling?
significance detector for the very first time. In the other
Really?
side, it was more like the temporal, when you do an ear pull, and you take the temporal off, that was my experience in the right side. But in the left side, when Kerry was working, at some point I told him there's significance detector, so everything was like stopped.
My feet went tingly.
Mm.
And then when he finished, the rhythm came again when he started tapping.
So this feels much better now? I feel it
But
now?
the experience is different from one bone to the other.
There was a still point or no?
A significance detector, which is a sudden stop of the craniosacral rhythm.
Oh, okay.
Yeah.
Meaning something very important is happening.
Yeah, okay, I didn't understand what you
Mhm.
And you see the difference on this side, it was
Yeah.
like,
said. Well, you,
Twisted
yeah,
quite
and
a
you
bit.
could never do that.
And the thickness too.
no, it was very thick, yeah.
Yeah.
Much
Oh,
better,
with the
isn't it?
actual bone?
And
No,
the-
you
and the
couldn't.
cranial-
You
No,
couldn't
cranial
actually do that
veins,
with,
the
come
muscles
close
in
to
the back,
doing that kind of
they
a
have
move.
softened
with the
all
actual
of
bone.
us.
So this is softened in the cranial base.
Mhm.
Yeah. Now, no, I'll be good. Thank you.
Okie dokie.
Very nice.
Let's look at our face real quick, 'cause we're seeing